Hi, everybody. I am Jessica. I'm a functional nutritionist, and I'm super excited to get started with introducing what I like to call nutrition power hours to all of you. It's really an opportunity for me to bridge that gap between you getting your functional medicine practitioner guidance and then me really bringing in the functional medicine approach to nutrition and how nutrition really fuels our body and is kind of that extra step just to make progress in your health journey. Really, it's just a way for me to give educational PowerPoints on different topics, help all of you understand the ins and outs of how nutrition really, really helps just feed our soul, mind, body, spirit, everything. We connect with food on so many levels. We need it for energy. We need it for sustainability in life. And we connect with people with food. We sit down with our families. We go out to restaurants. That is a social setting. It's a connection for all of us. It is based around food. And so if we can really gain an understanding as to what good food can do for our system and how if we can eliminate other things in our life and really focus on colorful, bright, nutrient-dense ingredients and how that can impact our body, that's what I'm really hoping to bring light to. And so each time I present, it could be a PowerPoint presentation on a topic. It could be a short cooking class on a certain recipe. I really, really love to bring to the table that not all healthy meals or recipes have to be intense and tons of ingredients. And I'm a mom. I understand having to cook with a family and kids, and so I really try to bring that to the table as well, and really hope that I show you all some recipes that are easy but nutrient dense or healthy. And I've also started doing where I might present a certain topic. And then the next time I present, I might do a recipe that aligns with that topic. And so really trying to connect those pieces for all of you. So that's just a little bit of insight as to what you can expect in the coming weeks with really being able to meet with me here for the Nutrition Power Hour. I do like to start at the basics. I think there's a lot of confusion as to, what is a functional nutritionist and how can they really help me? And I have my doctors, and why would I need someone else? And so I really wanted to start there with really explaining, what a functional nutritionist is and why I really, really feel that with all the patients I've worked with, aligning that connection with your primary care physician, with your functional medicine doctor can be so vital to your health progress and just your wellness journey in general. And so having a really great supportive team behind you can make the world of difference. And that's really what I'm here for, is just to be another support system for you and another tool that you can utilize to really help on your health journey and get you to a place where you feel good and confident about the way you feel, what you're eating, what you're putting in your body. So with that being said, let's go ahead and get started. I do try to keep some sort of curriculum as to what I will be talking about coming up. And so today we're going to talk about functional nutrition and what that really means, what it could look like to work with a functional nutritionist and how that aligns with also working with your primary care physician. And then some topics, and this does skew a little bit because if I learn something new or I'm at a conference or anything like that, if I learn new information, I get really excited about it and I want to share it with everybody. So it may not be exactly this kind of dynamic, but these are some things we can kind of look forward to. Is also talking about, the importance of looking at the whole body when identifying nutritional needs and how we can't just look at one aspect. I think a lot of times when I talk to patients, they've got their primary care physician and then they've got all these different specialists on the side. They've got their endocrinologist, their gastroenterologist, and there's all these people helping them, but they're not putting the pieces together because they're all looking at separate areas of the body. And so one thing I truly, truly love about the functional medicine model is that we understand the interconnected web of your body and how that all works together. And so you can't just look at one aspect of, if someone has thyroid problems, we're not just looking at their thyroid. We're going to look at their gut possibly. We're going to look at their adrenals and their sex hormones. And we know that it's just a matter of taking all those puzzle pieces and putting them together that really makes a world of difference in a health journey and progress. And so one of my topics I really want to address is how that interconnected web also leads into nutritional aspects. So we will discuss that at one of our upcoming Nutrition Power Hours, really going over the importance of, macronutrients and meal balance for everyone, and why we not only focus on food, but lifestyle too. I think that, as a functional nutritionist, it's not just food we need to focus on. You could be eating the healthiest diet in the entire world. All the food you could be putting in your body is clean, organic, but if you have high stress, if you've got poor sleep quality, if you're not getting proper movement throughout the day, all of these things can impact where it doesn't matter what you're eating. Yes, it may be helping a little bit, but you really need to have that full body approach and really focus on not only the food, but the lifestyle as well. And so that's a topic we'll work on. And then we might go over some, key dietary approaches, maybe keto, paleo, Mediterranean, focusing in on who that's good for, who it's not good for. And then possibly discussing links between autoimmunity and diet. So again, this is not a full set in stone curriculum, but just some thoughts of what you could expect in the next coming videos. And then of course, some cooking classes scattered in between there. I will give you some insight. I live in San Diego, California. I am a mom to a 3-year-old son, Oliver, and I married my high school sweetheart, and he is currently getting his doctorate in Chinese medicine. And so we as a family have a very big love for health and wellness and just feeling good, just getting outdoors, feeling that fresh air, eating healthy, waking up feeling well rested. I mean, who doesn't want to feel like that? And so we really love being able to learn what we learn and then share that with others. And so the cooking classes that I do, I'm forewarning you, I do not have an extravagant kitchen. I am not going to be on the Food Network anytime soon. I have a small kitchen, but I feel like that really drives that message that I want everyone to know is that you don't need to have extravagant things. You don't need to have this huge kitchen. We can make good, healthy, sustainable meals with what we have. And so when you do see my cooking classes, there's a chance you might see my son in there. Sometimes Oliver likes to pop in and help. It's impossible to keep a 3-year-old quiet during a half-hour, recording. And so I say the more the merrier, let him help. So you might see him in there, but the cooking classes are really fun. So something to look forward to there as well. All right, so let's get started. What is functional nutrition? What is this and what is the difference between me going to see a functional nutritionist and just working with my primary care physician? So as a functional nutritionist, you need to understand food and how it affects physiology, how it affects what's happening in our cells in our body, how it's affecting gastrointestinal concerns, whether it's immune responses or gut motility, or how it's affecting my thyroid or my sex hormones or my cortisol. There needs to be a deep understanding of that because that's what we're working with you on. You have these imbalances in your body that are causing inflammation. And so how can I help from a nutritional aspect with food and lifestyle to really help drive these things further? Your functional medicine practitioner is going to be, at the forefront with you, really going over the ins and outs of possible lab testing. And they might make some, nutritional recommendations and things like that. But your functional medicine practitioners are, they're very busy and they are working so hard to really dig to the root cause of what is going on within your system. And so they're developing a plan with, supplementation, and they might make, like I said, nutrition or lifestyle recommendations. But then I really get to spend the time with you kind of driving that even further and saying, okay, this is what was recommended. Here's what we can do. And we can start with A, B, C, and D. And so it's really a way to just further support you But having that understanding of how food really does have effects physiologically and metabolically. Starting in the digestive system, from there it can affect every system in our bodies. Immune, digestive, endocrine, nervous, reproductive, cardiometabolic. Our digestive system it's insane. What I've achieved over the past years with working with people specifically on their gut is amazing to see the results. And I'm not saying that's always the number one driving cause, but because of how our digestive system does host 70 to 80% of our immune system, a lot of the downstream effects that we're experiencing do stem from the gut. And so it's really, again, tying those pieces together of where is the inflammation coming from and how we connect all the pieces. So this knowledge allows the ability to really dig to that root cause, understanding the mechanism of action and how food can be contributing to a specific disease or dysfunction. A simple elimination diet, and this is really the gold standard for looking to see what kind of foods you might have in your system or have in your day-to-day, pantry of what you're eating, and how is that affecting how you're feeling. It is amazing to me how when you take certain things out for a couple of weeks and you reintroduce it back in, how good people start to feel and what they notice when they reintroduce them back in. But there is a rhyme and a reason to it. It's, we don't want you to stay on elimination diets long term. They are elimination. They are very limited. And that's not what we want from a functional medicine perspective. We're really driving forth that message that we want you to eat. We want you to have food options and diversity, and not just diversity through macronutrients like proteins, carbs, and fats, but also diversity through color. Color feeds our microbiome. It feeds our gut health. And so it's really finding that good balance where removing the foods that are triggers for you, understanding how those are really contributing to your disease or dysfunction, and then really trying to then replace those foods with good, healthy, nutrient-dense options. So it is not a way to have you be on some limited diet for the rest of your life where you feel like you can't eat anything. That's not the goal. The goal is to find how is this driving your disease state and what can we really replace it with that's nutrient-dense to then calm down your inflammation and get your body in a healthy place. So when working with a functional nutritionist, and, it's very different. If someone reaches out specifically just to work with myself, I have a bit of a different process. And then I have a bit of a different process when I work with practitioners. I love the team dynamic when working with a practitioner because it really allows for us to kind of give ideas back and forth, and I get the ability to really see what the doctor's recommending and then kind of, pair off that and go, okay, they're doing this. How can I enhance that more? And so there's a little bit of some different things here, but as far as when I meet with a patient, there's some things I look at right off the bat. So in order to dig to the root cause of someone's discomforts, their story is the most important aspect of the first consultation. And so even when I work with a practitioner, yes, a practitioner will take their own intake form, but I also do my own intake form as well, because a lot of the times there could be some overlap, but there may be questions on my intake that isn't on the physician's intake. And so the more information we can get, the better we're going to be able to help you as a person and as a patient moving forward. And the story of the patient, how things developed, how things onset with disease state or discomforts is so vital. Excuse me. So hearing that timeline of when certain symptoms or abnormalities started and what could have possibly been a trigger to predispose them to this is really vital. And it could be a lifelong of eating a standard American diet. It could be, were you born C-section or cesarean? C-section or cesarean greatly impacts our gut microbiome. When we pass through the vaginal canal, we get all those healthy bacteria from our mother, and that helps create a really healthy gut microbiome for moving forward in life. It really does set the tone. And it's the same thing with breastfeeding versus formula feeding. If you're breastfed, you're getting way more nutrients from breastfed than you are from formula fed. And that's not to say, I know there's a ton of women out there that intended for a C-section and something happened and they had to do a cesarean, and maybe they were able not to produce enough milk. And so, I mean, a lot of the times it's a personal choice, and sometimes it's not a choice at all. And that is not the mother's fault. It's nobody's fault. But these are things to be aware of, to understand maybe these are some contributing factors as to why you're feeling the way you feel now. When were you introduced to solid foods and natural allergens? So things like dairy and wheat. What age were you? Were there stressful events that have occurred? Did you have a traumatic experience? Did you have an extremely stressful year where all of a sudden after that year you noticed an inflammation increase in your body? Do you have frequent use of antibiotics? Antibiotics destroy our gut microbiome. Our gut microbiome is what keeps us healthy. It keeps that immune system working well. And then again, like I said, what was your typical dietary pattern growing up? All of these things play a huge part in how we get to help you, how we can really identify, look, okay, you're in this state now, but all of these things led up to that, and that makes more sense as to why you're feeling the way you do now. And so these are all things that we really need to look into to help you moving forward. So one of the things I love to utilize, which I will talk about this often, is the Institute for Functional Medicine. They are the gold standard for practitioners and health educators alike, and their teaching methods are amazing. I mean, they really do allow for so many people to get educated through them, and then for us to really help you through their teachings. And so there's a lot of great resources that I might share along the way that come from the Institute for Functional Medicine. Their resources and tools are amazing. They give the ability for health advocates everywhere to really just kind of spread the functional medicine dynamic and change the way people heal and understand their health. And so I'm a huge advocate, and I know a lot of people are. So one of their tools is the Institute for Functional Medicine Timeline. It's an amazing resource that really allows for us as health educators to make the patient feel heard, first of all. I think so many people are so used to, they go to a primary care physician, they're in there for 10 minutes, they barely get a word in, and then they're sent out the door. And that's after waiting a half hour to an hour in the waiting room. And so one of the biggest aspects of the functional medicine model is really creating a space where your patient feels heard, feels understood, has the opportunity to really talk about their story and where they're at and how things developed. And so that's one big aspect. And documenting their story to reflect and identify those possible triggers and areas that are really important to optimize those healthy outcomes. The more we get to hear from the patient, the more we get to have an understanding of where they're at in their health journey right now. So that's super, super vital. And that's why you'll find that most functional medicine practitioners do have extended appointment times. Your first initial consultation may be anywhere from an hour to an hour and a half, sometimes 2 hours. And then follow-up consultations can be a half hour to 45 minutes. And it's the same thing with functional nutrition. We really like to give the opportunity to have a good rapport with our patients and a good sit down and make them feel heard, because that is something that's very, very lacking within the Western medicine model. So this is just an example of the functional medicine timeline. And I wanted to give you all some insight into what this could kind of look like for somebody. So if we look over to the far left, it says antecedents. Antecedents are things that predispose somebody to a certain condition or a certain disease state. So for example, this is somebody, they have a family history of high cholesterol. They have past mold exposure. They grew up having frequent colds, so they had a lot of antibiotic use throughout their life. They were born cesarean, and they were introduced to solid food at around 5 months old. Now, if you look in the prenatal box right underneath that, the mother also had depression. And then if we start looking at birth all the way down through that arrow, we're going to start seeing things. So you'll see the box above it says triggers or triggering events. So this is the story. This is the patient's story. And so a lot of times when working with a patient, this is what I will work with, is having this timeline out and just listening and putting into place where things happened and what could be possible triggers. So, for example, the birth was cesarean, and we did discuss how that can really change the infant and growing child's microbiome and their gut bacteria. Frequent colds and lifelong, chronic strep throat, so frequent antibiotic use. So at 18 years old, this person had to have a tonsillectomy because they were having chronic strep throat. And at this point, so not only have they had a cesarean, but they also have had a lifelong of antibiotics. So if we look at that, the gut's not in a good place already just because of these things. This person continued to have headaches, so they used frequent over-the-counter NSAIDs, so anti-inflammatory things like Tylenol. At 25 years old, this individual started noticing chronic diarrhea. This was also the same time that this person had a bad breakup. So probably a lot of stress around that time. A year later, this person started dating a new person. So some shifts there within relationships and lifestyle. As you can see, they also started eating spicy foods, drinking caffeine daily, having, coffee. And then at 28 years old, abdominal pain started in. So not only was there now chronic diarrhea, but there was also abdominal pain. And they also got married. So between the ages 25 to 28, there was a lot of shifts, not just with relationships, which could definitely cause stress, but increase in digestive discomfort. And then married, if we've all planned a wedding, it's not necessarily the most relaxing thing to plan. It's exciting, but it's not relaxing by any means. So maybe even some more stress there. And then some food shifts. Right after that, her 2 dogs died, one of them from cancer. So another traumatizing event. I know all of us can get very connected to our animals and they're part of the family. At 29 years old, she got pregnant. And then if we're looking at 3 years old, there was some financial stress. She moved. She was still dealing with the trauma of her past dogs and them dying only 3 months apart. And with the move came a new job that had some financial aspects that weren't aligning with what their bills were. And then she did have her baby, so vaginal delivery, but she did have some postpartum depression. And then as she continued moving forward, around 32, her work became toxic. Her manager and her did not have a good relationship. It just became a place where she dreaded going to work. So you've got a lot of trauma to the body just between the ages of 25 and 32. And remember, this person's gut was already in, not the best state to begin with because of those other things that happened along the way growing up. And so then you put more stress on the body, more food shifts, more hormonal shifts because of pregnancy. Those things can cause an influx in symptoms. And then if we look up at mediators and perpetuators, these are things that can further exacerbate what's going on. So she's had a history of depression. She has a sedentary lifestyle because her chronic diarrhea and abdominal pain started getting so bad that she was almost bedridden. She just couldn't get out of bed because the pain was so bad. She had postpartum depression, and their new apartment that they had moved into had mold in it. So she was getting mold exposure. So all of these things. And then if we look at her current symptoms down on the bottom right, environmental allergies, high cholesterol, low energy, gallstones, neck and back pain, mast cell activation syndrome, which is a histamine disorder where you produce too many histamines, which definitely causes disruption in the gut and inflammatory responses. She would get itchy hives over her body, and it was stimulated by heat. So working out, taking showers. She had blood in her stools, dry skin, weight loss, abdominal pain, fatigue, headaches, depression, bloating, ear fullness, and undigested food in her stool. This person has a lot going on. And so I like to tell this story because this is my story. This is me. This is what happened to me. I had a terrible, terrible health year. 2 years. It was terrible. And I just want all of you to understand what functional medicine can do for somebody, and certainly being mindful of the nutrition aspects as well. And understanding and looking at me now. And, I like to think myself fairly healthier than I was. I'm not in bed anymore. I don't have abdominal pain. I did get diagnosed with Crohn's disease, which probably is that, bowel shifts and gut pain and things like that. But I really took a hold of my health and really was mindful of my food intake. And I took out gluten. I took out dairy. I went to school. I got my master's in human nutrition and functional medicine. I did that because I wanted to learn more so I could help more people understand that you don't have to live this way and you don't have to feel that way. And it's not something where medications or pharmaceuticals are the only option. There's a lot of different options out there and natural remedies that can really help you and get you back to a place where you're feeling good. And so it took me about a year to really get back to a healthy state, but I'm exercising again. I can do running. I can do high intensity exercises. I get to actually play with my son. I couldn't even spend time with him. I was in bed all the time. I get to play with him. I get to cook family meals. I'm not constantly running to the toilet. I used to be in a store. I'd be grocery shopping and I had to go so bad I'd have to leave my grocery cart and just run and go. I don't have that urgency anymore. And in a way, I really got my life back. And so again, this is such a big aspect, is hearing somebody's story, understanding how things developed, understanding that stress was a component. And so for me, it wasn't just shifting my nutritional approach. It was really focusing on my lifestyle as well, creating a healthy atmosphere, giving myself space. Yes, I have a 3-year-old. Yes, I had just had a baby when I was, 30 years old. But I really created a good routine where I had my space to be in my own thoughts and really relax. And then I really created a good environment for, me and my family to spend time together, not let my work get to me. I actually shifted positions in my job because that was a toxic component for me. And within 2 months, so I shifted my nutritional approach. I focused on stress management, and that took me about 8 months to 9 months to really get back to a good place where I was feeling really, really good. And within 2 months after that, so about a year total, I ended up switching my position and finding a new practice to work with, and my bowels normalized. And so stress is a huge component, no matter what people think. I know they think, oh, it's okay, I can manage my stress well. When we are in a stress state, it's wreaking havoc on our bodies. And although we may think we're managing it well, and a lot of times we can't physically feel stress, but our body can be under chemical and physiological stress. And you may not even know it, but your body is in that, fight or flight mode constantly. And so these are all things that we work with patients on, from a functional nutrition perspective, is the food, yes, but lifestyle as well. There's so many different components. And again, putting those puzzle pieces together to really find what's going to work for somebody. And so this is another one I just wanted to show you. This is not me by any means. And it's just a way for you to also see how toxins can play a part. So this person at birth, the mother had antibiotic use due to illness. So the antibiotics are then affecting the fetus. There was elevated PCB levels found in the mother. And I'm not going to go through all of these toxins. They can get kind of confusing, and I don't want your mind to spin or your eyes to glaze over. But I wanted to show you how toxic exposure to plastics, to non-organic food products, to perfumes. These are all things that can disrupt our system. So PCB levels found in the mother were elevated. That passes on to the infant. Meat and poultry was introduced in the diet, and it wasn't organic, so there was different exposures to toxins there. The father smoked, so there was secondhand smoke exposure. There was the family grew up on a farm, so there's exposure to toxins there within the crops and what they're sprayed with. Antibacterial soap has something called triclosan, and that exposure can disrupt our system. Food approaches with high fructose corn syrup or artificial sweeteners. There's toxicities in processed foods like bologna and hot dogs. Perfumes, like I said, phthalates, mercury consumption from too much fish. The makeup we wear has something called DEP phthalate. It disrupts, it's an endocrine disruptor. It shifts our hormones. Poor air quality. If someone grew up in a city or, in that type of atmosphere, constant dry cleaning. And so this is not meant to scare you. This is something to show you that this is another form of a timeline from a toxic exposure perspective for you to really see that, again, the story of every single person is the most crucial when really seeing someone for the first time and developing a strong plan moving forward. Yes, the testing gives us a lot of insight, but we gain a ton of insight from the story. And so looking at my story and the shifts with lifestyle, nutrition, the way I was, born, and then shifting to this type of approach and seeing all the different toxic exposures that somebody has, these are now another burden on your body. And so again, very important, very vital for us to know, because these are all things that play a part in us understanding how to help you best. So really, what's next? Once a patient's story has been told, observed, we've identified certain stress components, whether it be food or toxic exposure, financial stress, poor relationships, whatever the case may be, that's where we kind of move forward. And these allow for not only food recommendations, but like I said, also lifestyle factors, which all play a part in our health. We've talked about that a lot today. So typically, the elimination diet is a really good starting point. And I know that it's a very common starting point, but the reason for that is because it works. The food sensitivity testing that is out there right now is not as beneficial as we would like it to be. A lot of times with food testing, they test the raw forms. So they'll test you for eggs and pork and all these other things, but who's eating raw eggs and who's eating raw pork? Nobody that I know of. And so a lot of times the way they're testing food sensitivities is not always reliable, and it lacks specificity. And so really the best way for us to see what is going to work for your body is the elimination diet. We get to take out those pro-inflammatory foods, common triggers, and we really get to see how is your body going to respond. If we take it out for 3 weeks, 3 weeks is the half-life of an antibody for food. And so if we can get that antibody down and then we reintroduce the food, if you have a reaction, you'll have an antibody response and we'll know if that food is for sure causing a problem. And so that's really why there's typically that 3-week time frame that we really, really try to encourage. The more you take it out or the longer you take it out, the better, because again, we're decreasing that half-life of an antibody. And then sometimes based on individual needs and discomforts, we can also explore things like histamine foods, nightshades, fermented foods. But because we eliminate quite a bit within the elimination diet, we really try to navigate through that carefully to where we're not taking out too much, because we still want you getting your nutrients and what you need for your system. And so I put an example down here, if someone frequently has hives, histamine foods could be contributing. So that would be something we would explore for somebody that maybe has allergies or hives or things like that, where there's too much of a histamine response and maybe foods are a contributing factor. I just wanted to finish off here. I had, this is kind of an example case study. So if we have, Jane Doe, and she's got her chief complaints being, bloating, gas, abdominal pain, diarrhea, frequent itching and red patches, headaches, wanting to have some weight loss. And then as far as lifestyle factors, she was born vaginally. Mom was frequently sick when pregnant, was on antibiotics. She grew up on a farm, consumed a lot of red meat and dairy her whole life. Was married with 2 children. Husband divorced her at 38, forced her to become the main provider for herself, ended up going bankrupt, shares children every other week, got a full-time job as a front desk assistant at a veterinary clinic. So this is an example of somebody I've worked with. And so as you can see, there's been definitely a stress component within this person's life. And so the main takeaways here is definitely susceptible to poor microbiome from the mom's antibiotic use, growing up and living on a farm, possible exposure to chemicals, high red meat and dairy consumption causing high inflammation, and then definitely stress components with the divorce and then having to shift with the financial issues, which can directly impact the gut. And so a plan moving forward would be to try to reduce inflammation. Start the elimination diet along with low histamine for 3 weeks. Histamine because she is experiencing frequent itching and red patches, also headaches. And then really working and moving forward with stress relief and management techniques in that regard because, again, she's had a lot of stress. So I hope this was helpful. I really wanted to break down what it's like to work with somebody like myself, why we ask so many questions, why the paperwork can be lengthy sometimes, but also hopeful that you appreciate how much we really want to hear from you and how much it is helpful for us to really see so we can guide our way through this with you as your health team. So again, I hope this was helpful. That is all I have for you all today. If you have any questions or recommendations or topics you would like to discuss, please do not hesitate to reach out. I love educating and just being able to help people navigate through things with specific questions or thoughts that they have. So do not hesitate to reach out, but I will see you all next time. Bye.